After the outbreak, reopening Rochester.
Well, as this pandemic unfolds, coronavirus testing continues to be the most significant way to understand the spread. From developing the test to making sure more Minnesotans have access to it, Rochester's own Mayo Clinic has been at the forefront, now having the highest capacity in the state for processing tests. Now, KIMT News 3's Jessica Bringy is finding out how COVID-19 testing is going to influence when our economy reopens and what that would look like. It is the second installment of our 5-part series, After the Outbreak, Reopening Rochester.
To date, Minnesota has performed 47,000 coronavirus tests, many of them being processed here at Mayo Clinic. Just about 5% of those have come back positive. And I'm learning that having up-to-date information is going to play a big role in the decision lawmakers make to reopen the economy. Governor Tim Walz says Minnesota would need to drastically increase COVID-19 testing in the next few weeks to start safely reopening.
Minnesotans should just agree we are not testing as much as we should.
And State Representative Tina Leibling of Rochester knows we are all wondering what it will take to make that happen.
What kind of testing do we have and what do we need to get us where we all want to go, which is going back to reopening our economy?
Daniel Huff with the Department of Health says the state is working to dramatically ramp up testing, but has to use it strategically for now.
When we prioritize healthcare workers, we want to prioritize those who are in direct contact with patients more than, say, someone who is part of the healthcare system.
Mayo Clinic laboratories have been at the forefront of developing and supplying these tests for the state. But in order to have widespread testing and not just focus on vulnerable populations, they need more supplies.
Most of the individual healthcare systems and governments have wound up having to compete with one another to access what supplies currently exist.
The University of Minnesota Medical School is stepping up to help. It's working on manufacturing the protein needed for testing kits.
So there are many ways of not being dependent and left, behind, that we can rely on our own resilience in the state of Minnesota.
When it comes down to it, there are a lot of questions about how to quickly but safely reopen the economy. And lawmakers are pressing health officials to get those answers.
Not cripple the economy the way it is now. This has become quite a bone of contention, and just wanted to hear from the medical side what your thoughts are about that.
The state's Department of Health did defer those questions, but added it's a discussion they still hope to have in the future.
We will think about how to do that, and the part of that will be having the right people in the room, so to speak, so that we can have a good discussion about that with all of the viewpoints we would need to hear from. Health officials say they're doing everything they can to expand COVID-19 testing throughout the state. But as Olmsted County Public Health points out, tests are just one data measure used to review and adjust plans. In Rochester, Jessica Bringy, KIMT News 3.
Now, in tomorrow's installment of After the Outbreak, Reopening Rochester, Jessica is going to look at who makes the decisions regarding reopening. You can catch that right here on KIMT News 3 at 5.
We track storms to alert you first. This is KIMT Storm Team 3, weather coverage you can count on.
And I'm joined now by KIMT Storm Team 3 Chief Meteorologist Chris Nelson. And Chris, sounds like things are going to warm up a bit, huh?
And it's been a while since we've been in the 70s, at least in Rochester. I know 2 weeks ago we were in the 70s and almost hitting 80 in some parts of North Iowa and even in southern Minnesota. But the last time we hit